Room check.
Are you in 0.5?
Yeah.
Okay. Here's my chart. No writing front and back. I'm just going to review it. So today I have Joanne Peterson, date of birth 12/10/47, and she has no allergies. She was admitted for a fall to the med-surg unit. She has an admitted diagnosis of dehydration. She has a past medical history of hypertension and asthma. Her medication she has right now is furosemide, albuterol inhaler, and acetaminophen. In handoff report, her vital signs all look normal. She's learned oriented and resting in bed. She's ANO ×4. Pupils are equal, rather reactive to light and accommodations. She is admitted for IV fluids and safety assessment. She did just receive her Fluzone vaccine, so that's good. But she also has another medication on her MAR that needs to be given now. And it looks like it's her heparin, 5,000 units per 1 milliliter. And that's going to be subcutaneously, so that's going to go into the fat in her belly, and I will make sure that it's not being administered in the same site as her previous one. So let's go ahead and introduce myself to the patient. Hand hygiene, provide for privacy. Hi, I'm Maddie. I'm going to be your nurse today. Can I have you verify your name and date of birth, please?
Joanne Peterson, 12/10/47.
I'm going to check her wristband. Joanne Peterson, 12/10/47. Perfect. All right, Joanne, so we did just administer your flu vaccine. Looks like everything well went there. Can I have you verify if you have any allergies or not?
No, I don't.
Okay. So now you have heparin. That is the next medication due on your MAR. Do you know why you're taking that by chance?
Not entirely.
So the main reason for this is to help manage and treat of venous thromboembolism, which is also comes with deep vein thrombosis and pulmonary embolism, and it's going to help manage your blood clotting. So with that, it's going to use a 5/8 25 gauge needle, and it's going to go subcutaneously in your stomach to your subcutaneous tissue. And I'm going to make sure that it's not being administered in a previous spot. So that if you were administered on your left side, your right side last time, I'm going to administer it on your left, okay?
Perfect.
Does all of that sound all right to you?
Yep.
Perfect. I'm going to make sure you have your collet, your bed is in the low position, and your side rails are up. And I will be back when I have the medication.
All right.
I'm going to hand hygiene on my way out. And then I'm back at my R. So here I have heparin. It is brand new, sealed, and it is also not expired. So I'm gonna check this. I have Joanne Peterson, date of birth 12/10/47. She has no allergies. I have heparin of 5,000 units per 1 milliliter to be administered subcutaneously, and that is due now. I'm gonna go ahead and do my second med check. I have Joanne Peterson, 12/10/47. She has no allergies. I have her heparin, 5,000 units per 1 milliliter to be administered subcutaneously, and this is due now, and the indication is for her to prevent blood clots. So I'm gonna go into the room and we'll get this over with. Knock, knock, knock. Hand hygiene, provide for privacy. Hello, Joanne. How are you feeling?
Good.
Okay, can I have you verify your name and date of birth, please?
Joanne Peterson, 12/10/47.
Yes.
All right. I'm gonna check your wristband. And it still says Joanne Peterson, 12/10/47. So I have the right patient. I'm gonna go ahead and do my third med check. Before I do my third med check, I do want to tell you about some side effects you may experience. You may experience some signs of hemorrhaging. You may have thrombocytopenia, which is a low platelet count, and then you also might experience an allergic reaction, but I'm not too concerned about the allergic reaction because you said you don't have any known drug allergies. So she verified her name and date of birth. I'm going to go ahead and I'm going to do my third med check. I have Joanne Peterson, 12/10/47 with no allergies. I have heparin, 5,000 units per 1 milliliter, due subcutaneously with a 25 gauge needle, and it's 5/8 inches, and that is due now. So in handoff report from the nurse stated that she had her last injection on her right side, so we're going to go ahead and administer that on her left side, 2 inches away from her belly button. Okay, so I'm going to go ahead and drop my medication. So I'm going to ask that my video camera come over here, please. I'm going to clean the top of this. That can go in the garbage. I'm going to open my syringe. And I'm going to open my blunt needle that's going to be used for the drop.
Yes, give me 1 second. I just have to report for her, and then I'm finishing watching her validation. But yes, I will.
Okay, so I've cleaned the top. I need 1 unit, so I'm gonna draw back to the 1 milligram. I'm gonna draw back to the 1 milligram line. I'm going to insert, push in all my air, flip it.
You want to record together?
Sure. Are you ready?
Yeah. I'm doing my IV push again. So after that,
I've removed it, and now I'm going to recap my needle. I have drawn up 1 milliliter of heparin. So now I can discard of my blunt needle in my sharps container. And now I'm going to set this up, and then I will expose the area of the patient that I need. Going to remove that. All right, Joanne, I'm going to expose the left side of your belly, okay? While still providing for patient privacy. I'm going to take an alcohol pad, and I'm going to clean my area. I'm going to pull back my safety cap and pull that back. All right, Joanne, so just to verify one more time, can you verify your name and date of birth?
Joanne Peterson, 12/10/47.
Perfect. I still have 1 milliliter of fluids in here. I'm going to insert bevel up. I'm going to pull the skin, and I'm going to go in at about 45-degree angle. I'm going to administer, pull it out, and then I'm going to use a hard surface to cap my needle and discard. All right, Joanne, I'm gonna hang out with you for a little bit, okay?
All right.
So I'm just gonna clean up my station a little bit. Okay, it's been about 15 minutes. Joanne, is everything still feeling okay?
Yep.
Perfect. Let me know if you have any questions or if you need anything else from me. Here's your
Alrighty.
call light. Your bed is in the lowest position. Your side rails are up. I'm going to remove myself from the patient's room. Hand hygiene on my way out. Continue to provide for patient privacy, and then I'm going to document that she received her heparin shot.